Go.
Nick, let's start with you.
I went to PT school at AT Still University in Mesa. I graduated in 2011, which, quick math, says that I'm coming up on 13 years out from school, which is longer than I thought it was.
And how long have you been with Spooner?
8 years. This past May was 8 years.
I went to Northwestern University in Chicago, and I have been a therapist, I'm not going to tell you the year, 30 plus years. And I have been with Spooner. I sold my practice to Tim in 2016, so it's about 8 years.
I've graduated from AT Still University as well, back in 2018. So now it's been 6 years as a therapist here, but I've been with Spooner since 2013 as a tech over at Scottsdale Clinic with Carrie. So yeah, it's been 11 years a part of Spooner now.
I still distinctly remember like my interview with Spooner. During that interview, Tim Spooner was like, there's a vestibular course coming up. If you want to come on, we can probably figure out a way to pay that for you, and da-da-da. And I was like, I'm just here for an interview. Like, I haven't even told you I want to work here, you know, like, sure. So like from the get-go, there was just a lot of support in like, what are your interests? What do you want to do? How are we going to support you in that?
I would say as a new therapist, I wish somebody would tell me it's okay to know nothing but feel like you know everything, because I'm still feeling that, right? That the more you learn, the more you don't know. And of course, you're a student, you're like, I need to go through all these tests and measures. Like, no. How'd the patient feel? I felt great. Great, just stick with what you're doing right now, and then maybe you can slowly add in a couple things.
No one knows whether or not you're doing a good job at your job better than the person who's in pain. So if that patient tells you like, that felt good, like I feel better, like don't second guess yourself, don't sit there and wonder like, yeah, but I should have done this, and like my mentor keeps talking about this and I didn't do that and I forgot. Like if your patient is telling you that they feel better, then you're doing something right.
As long as you have that confidence and you're doing the right things ethically, I think you'll be fine. You can go home and look something up, you can find another therapist to help you. So that was real important. The other thing that we didn't have back when I was in school, we didn't have all these specialties like we were talking, and I think it's really important for the young therapist, you don't need to know what you need to know on day one. Go try things, go take your time. You know, we have the continuing ed funds, we've got the great therapists in all these clinics. Take the time and go out and just spend that time to find out what other people are doing, then you kind of find out what your passion is.
Incremental progress is what we're looking for. We're not looking for some instantaneous magical result. We're looking for the progress and being able to celebrate those progresses with them and being able to celebrate those small victories along the road.
And you know, it's taken me this many years to find out that I love treating cancer patients. You know, I thought I was always going to be just in sports, crawling on the floor, jumping out, doing everything. And now I'm like, oh, this is so nice. Let these guys do it. But so.
My knees are getting old.
Yeah, no, yeah, I'm there. Yeah, for me.
I know my daughter's down there. Come on.
But I just think exploring and finding out truly what your passion is what I would tell these young therapists. There's so many avenues that we're helping people with, and I feel like just so many things we can do, and so we're becoming the first choice now, and I just think that's really exciting.
I think we just don't, as a profession, I think we're getting way better at marketing ourselves within not just the community, but the sports teams, just everybody around us understands finally what physical therapy or physical therapists can do. I think seeing someone, say a high school athlete, is so down on themselves, depressed, whether it's a surgery or an injury, and then walking them through that walk of life, mentally, spiritually, emotionally, you go through that progression and that ride with them, and then seeing them at like their discharge day.
Empowering those people who come in with problems that that are preventing them from being able to do what they want to do, you know, for them to overcome those obstacles, and not that you're doing that for them, but you're just guiding them along and empowering them.
There's a lot of emotional, psychological things you deal with, so I think being just a part of that and the trust that they put into you, and just really helping them know that it is okay what you're going through and you are going to get back to doing the things, enjoying your family, and the things that they love to do.
One of my favorite moments is when they go, I don't need you anymore. Not that you did it, but that you got to be a part of that story is pretty incredible.
That was really good. Thank you, guys. Heading into the family.
I'm really looking forward to some collaboration.
Ready. I'm always ready.